years or few months we are seeing the awareness about this increasing, and the students asking about what all depression is about. Okay, and the purpose of making this video is to make you aware and identify certain red flag signs that when you are supposed to seek help. Okay, when you are supposed to seek help. Okay, so and it is very okay to ask for help. First of all, let's start with the prevalence. This is a study done in New Zealand, that depression in medical students, and it states that the students are more prone to have depression because of many particular reasons like academic requirement, time pressure, etc., etc. It is stated that as many as one third of medical students need professional help for depression. One in three. Okay, one in three students. Some students among you may say it is an over exaggeration of the data, but the routine prevalence of depression is 12 to 17%, that is 1 in 6 to 1 in 8. And we usually say that depression is twice more common in medical student as compared to general population. So if general population incidence prevalence is around 12 to 17%, we expect at least 25 to 30% in medical students. And this data is supported by American Medical Student Association, the prevalence study done. Okay, so we need to understand this as an important concern. Moreover, for students who know me, like I'm a practicing psychiatrist in Delhi for the last 5 years, and being in teaching for undergraduates, I'm meeting a lot of students every year. We are a part of the team DAMS, where I'm teaching every year 20 to 30,000 medical graduates, and it is very likely that the students seek help. So I have an insight about students' depression. Moreover, most of the people seeking me, I think I'm the one of the very few psychiatrists whose most of the patients are medicos and doctors. So I believe that I should speak on this topic a little and enhance your understanding on this. Research also states that mental health deteriorates during medical school years and eventually deteriorates over the years. So from first year to final year, and when you enter workplace like internship, housemanship, job, etc. What do you need to understand? Why medical students? Why medical students are a little more target? First, limited awareness about depression. No matter how much the teaching has improved in the medical colleges, even psychiatry department teachers are teaching over the last few years, I'm seeing much improved. Still, I believe that as an undergraduate, the awareness about the disease called depression is limited. Okay, so there's limited understanding about this disease. Number two, reluctancy to seek help. We all know that the doctors are one of the worst patients and they are less likely to seek help. In fact, when routine fever things happen, people don't take antibiotic properly. Just imagine for depression with the social stigma attached. I've seen students messaging me, calling me, sir, I want to visit you, but I don't want any one of my batchmates to know, which is very obvious because you would not like your friends to know that you are consulting me. And moreover, time management issues, you know, you are always occupied in your academic assignments and the work related to your college, etc. So you may not be able to take time to this. I think these are the two major barriers: reluctancy to seek treatment, stigma, and your time management issues. Then prejudice about treatment. Most of the medical students understand about depression when they enter second year MBBS, because second year MBBS, when they read pharmacology, they read about antidepressant drugs, so they understand what is depression all about a little. But that antidepressant chapter in pharmacology textbook has been presented in such a way that we get a notion, we get an understanding that all these drugs have a lot of side effects and have huge dependence potential. And it is a common notion carried in the general public also, that almost all psychiatric drugs cause dependence. So that notion is carried among in medicos as well. Then multifactorial reasons, psychosocial stresses. Actually, if I understand depression as a manifestation of stress, then every stress gets added up. Academic pressure, we know that MBBS is one of the toughest courses in the curriculum. So assignments, class test, post assessment test, then sessional test, preliminary examination, university examination, so many examinations putting pressure. Cultural things, why I'm putting cultural here, because over the years I have seen some first year students landing up in depression because of change of place. There's a concept of all India PMT in India, where 15% quota is given to the outside that particular state students. For example, you are a 12th pass or domicile of X state, and then you go for MBBS in one another state. Although the environment is good enough, but still I believe some people get a culture shock, language differences, uh, difficulty in adjustment issue, things at a new place. And the third to add on to this is personal things. The personal things may be related to the family, anything wrong in the family, or any person diseased, or some problem going on in the family, or then some financial issues which some of the students have, or some relationship related. Why I'm putting a word about everything? Because everything gets added up. Okay, all these things get added up. Now, when to seek help, the purpose of this particular video. When to seek help, how will you identify that you need a professional help and you must consult a psychiatrist? So this is the red flag signs for depression. Low mood persistent for more than 2 weeks. When you are feeling sadness, and that too for more than a period of 2 weeks, please take a note of it. Remember, minor mood fluctuations like feeling sad for a day after a poor result in an exam or after a quarrel with your friend is absolutely normal. So you have to understand low mood more than 2 weeks. Please remember this word, 2 weeks. Then decrease enjoyment and interaction. You don't feel like enjoying like the way you used to. We use a term for this called anhedonia. Decrease interest in previously pleasurable activities. Enjoyment, what do I mean by talking to the family member, watching TV, watching web series, movies, going out, hanging out with friends, okay, talking to friends, and the kick, the feel, the pleasure you get in that, that is decreased. Then lack of drive or motivation. When students enter first year MBBS, they have a lot of drive, a lot of motivation. I want to do this, a big career, big goals. But eventually, if the motivation level is dropping down, you don't feel like studying, you don't feel like working, you don't feel like doing anything. That is again a sign when you need to seek help. Decrease in self-esteem and confidence. Many times students believe that I'm not fit for this course. I believe you may not be fit for this course because at that particular time your mental status is depressed. Depression makes you lose your confidence, your abilities, your self-esteem is down. So maybe it is not that you are not fit for the course, it is that you are having a disease which is making you believe that you are not fit for the course. So I've seen students getting dropout from MBBS in first, second year itself, saying that I am into a wrong course. I don't believe so. Maybe that the disease is starting manifesting. So you need to seek help if you have self-confidence and esteem loss. Then unable to concentrate on studies. One of the very commonest symptom I have observed in the students seeking help to me is a difficulty in concentration, literally sitting in front of the book but unable to concentrate. It is mentioned as one of the symptoms of depression. Because of decreased concentration abilities, the memorizing power is decreased and hence the performance that get decreased because the recall issues happen in the exam. And when the performance is decreased, then the further the mood gets depressed. So it's kind of a vicious cycle. Concentration decrease to leading to memorizing abilities decrease, leading to your attention impair, grasping abilities decrease, and eventually poor performance. Then death wishes and suicidal ideas. We all know that the extremes of depression is a death wish, feeling like life is not worth living, and suicidal ideas. I want all of you, the students who are listening to me, to take a snapshot of this page, that these are the symptoms when you are supposed to seek help. And how did I derive this symptom? From the standard acronym of depression diagnostic criteria. You open depression diagnostic criteria, the standard USA based DSM, Diagnostic and Statistical Manual 5 criteria by American Psychiatric Association is SIGECAPS. Sadness of moods, that is low mood I just mentioned. Interest decrease, that is anhedonia. Guilt feeling. Energy lack, concentration lack. Then appetite changes. Appetite may be reduced in depression leading to weight loss, or appetite may be increased in depression leading to weight gain, as seen in atypical depression. Psychomotor activity changes, mostly retardation, sometime agitation. Then sleep changes, mostly decreased sleep, sometime hypersomnia can be seen in atypical depression. And finally suicidality. DSM says that 5 out of the 9 symptoms present for a minimum period of 2 weeks qualify for you being depressed. This is the operational criteria we apply to diagnose anybody as being depressed. Now, what do you need to understand? The three common myths about depression I want to clarify for medical student. First of all depression are caused by stress. No, no, not at all. Whenever somebody becomes depressed, we call them that he or she might have been depressed because of X reason, Y reason, this stress. There is a concept of depression called endogenous depression, where the depression is caused by neurotransmitter decreased. So all depression are not caused by stress. It may be endogenous. It is a disease by itself, biological depression. Now some students try to pretend to be strong, and sir, depression is a condition of mental weakness. If I pretend to be strong, do listen some motivational videos, do some yoga, I don't need to take medicine, I'm strong enough, I'm strong enough. Understand, keeping yourself low and not taking medicine is not a victory. Okay, sir, I have made myself cured of depression without medicine. Understand, if you are able to make your mood uplifted, that means it was not at all depression. Depression is that low mood which doesn't get easily uplifted. You are not able to uplift yourself. So if you believe that you don't need treatment, that means probably you were not even depressed. That was a subthreshold depression, a simple low mood which got uplifted. Good for you. But suppose you have been kept keeping on trying, and you are not able to get uplifted. Please understand that it's always better to take professional help, because depression is a definitely identified clinical syndrome, and if early intervention is done, then the serious consequences like suicide can be prevented. It is a treatable disorder. The most important part of this, it is a treatable disorder. Okay, sir, I don't want to take medicine. I mentioned this point earlier in the video that students have a notion that it will make dependent, and I will face serious side effect. First of all, not all antidepressants have dependence, and their antidepressant dependence potential is not as great as we have with some other medicines in psychiatry like benzodiazepine. So it is not that all antidepressants have dependence. Not all patients need lifelong treatment. In fact, most of them don't need lifelong treatment. Okay, and we have nowadays non-pharmacological therapy, very well working psychotherapy. If you are interested in non-pharmacological intervention for depression, we have a very good therapy, CBT, cognitive behavioral therapy, available. So it is not that only antidepressant is the option. Okay, finally, what are my recommendations from this particular video which I have made purposely? Keep your mental health on your priority list. I know you guys keep your physical health on your priority list, but I recommend strongly, we are going to face a mental health epidemic. We are observing an increase in case of depression. I'm making this video in midst of this corona things and lockdown things going on, and a national crisis, in fact a global crisis going on. Over the last couple of months or last 3 months, I am seeing a surge of cases seeking me. Not necessarily depression, but many of stress related problems. So please keep your mental health on your priority list. It is a treatable disorder. Please understand, depression is something which is not at all not treatable. More than 2/3 of the patients recover completely on treatment, more than 2/3. So please remember that it is a treatable disorder. Ask for help. What are the people whom you can seek as a medical student? Ask for help. The best is your own college department of psychiatry. You can approach either a consultant. If you're not comfortable with a senior, you can always approach residents, the postgraduate students, the first year, second year, third year, MD, diploma, DNB students in your hospital. I'm sure as an undergraduate, as a person of medical fraternity, they would be more than happy to help you. Okay, please don't worry about the stigma and confidentiality issues. You can request the resident that mostly and in almost all the cases we keep every history 100% confidential which you give to us. Don't worry about these things. It's better to seek for help than to face consequences. And finally, telepsychiatry online consultation is a boon. Recently the guidelines have been modified, so we can give audio, video, text consult. Even I am nowadays practicing mainly telepsychiatry, so it is a good thing that people from different areas can approach psychiatrists sitting in different areas through video, audio call. So it makes you even more comfortable. So that's all I wanted to give you an insight about depression through this video. Hope you make use of it. Please seek help whenever you need. Thank you.